Have you ever wondered why, after all the pills, all the stretches, maybe even all the physical therapy sessions, your lower back still hurts? Why it keeps coming back just when you think you're finally free from it? It's like you're trapped in a cruel game of whack-a-mole. One week your back feels okay. The next, it seizes up when you reach for a sock or lean over to rinse your mouth at the sink. And there you are again, rubbing it, popping painkillers. Maybe even questioning if this is just how your life is going to be now. You're not alone. Millions of people around the world live in the same frustrating loop. They try everything that seems obvious. Over-the-counter anti-inflammatories, hot packs or ice packs, endless back stretches from YouTube, massage guns digging into tight spots, maybe even steroid injections or consultations with surgeons who tell them ominously, if it gets worse, we might have to operate. Yet here's the hard truth no one ever told you. Most of these solutions only treat the symptoms, not the source of your lower back pain. That's why the pain keeps coming back. Because the real issue is still there, silently simmering beneath the surface. It's not just your muscles. It's your brain and nervous system keeping your back stuck. This might surprise you. Research in the last 10 to 15 years has completely changed how experts understand chronic lower back pain. We used to think it was mostly about weak muscles or stiff joints. So naturally, we treat it with pills, heat, ice, stretches, and in some cases, surgery to fix a bulging disc or remove arthritic tissue. But new neuroscience shows something deeper. Chronic lower back pain is often a problem of your nervous system, not just your spine. Think about it. If your back was just mechanically broken, if it was purely about wear and tear on discs or tiny arthritis spots, why do scans show that many people with serious degeneration have zero pain, while others with only minor changes are in agony? Why do so many people go through back surgery, only to have the pain return months later? It's because your brain plays the biggest role. When it senses your back might be threatened, even by small things like stress, fatigue, or old memories of injury, it sends out a protective signal to tighten your muscles. It's like a built-in armor system. That's why your lower back feels stiff and locked, even when structurally it might not be severely damaged. Your nervous system is keeping it in a guarded state to protect you. Why the standard advice often fails you. Ever been told, just strengthen your core more and it'll go away. Stretch your hamstrings and hip flexors. Your posture is a problem. Take these anti-inflammatories for a few weeks and let's see. While these things can help temporarily, they often miss the bigger picture. Here's why. If your brain believes your back is in danger, even if it's not, it will keep tightening your muscles to brace it. Stretching can sometimes even trigger more guarding if your nervous system doesn't feel safe. That's why you might stretch daily and still feel like a tight rubber band. Painkillers just mute the alarm temporarily. They don't teach your nervous system that it's okay to relax. And surgery? It can be life-saving in very rare cases, like massive disc herniations causing true nerve damage. But most back surgeries don't change the protective tension patterns your brain has learned. That's why reoperation rates in chronic post-surgery pain are so high. This isn't your fault, and you're not imagining it. Now, maybe you're sitting there feeling frustrated or even a bit defeated. Great, so it's all in my head then? Absolutely not. Your pain is 100% real. You're not crazy and you're not weak. It's just that the alarm system that governs pain is based on both your body and your brain. When your nervous system is stuck on high alert because of old injuries, chronic stress, even simple life habits, it keeps your back muscles tight, your joints compressed, and your pain sensitivity dialed way up. No amount of muscle building, stretching, or popping Advil fixes a nervous system that's stuck in protection mode. That's why so many people live in frustration, feeling like nothing works long term. But there's good news. You can actually teach your brain to let go. Here's where it gets hopeful. Because if your brain is a huge part of the problem, it also means it can be a huge part of the solution. You can teach your nervous system to stop guarding your back so tightly, to let your muscles unclench, to turn down that pain alarm. But it's not through brute force. It's not about hammering your spine with harder workouts or stretching for hours a day. It's about gentle, smart signals that tell your brain, hey, it's okay. This back is stable. It's safe to move. It doesn't need to clamp down anymore. In the next parts of this video, we're going to show you exactly how. You'll learn why tiny shifts in your breathing, your movement habits, even your daily stress levels can completely change how your lower back feels. We'll break down simple routines that actually teach your nervous system to relax. Imagine being able to get out of bed without wincing, stand at the counter and chop veggies without needing to lean on one leg, or walk around the block without your back seizing up. That's what's waiting for you when you fix the root cause, not just the surface symptoms. Your body is trying to protect you, but it's overreacting. Imagine your nervous system like a fire alarm. Its job is to keep you safe. When everything's normal, it's quiet. If there's real smoke, it goes off loudly so you can get out. But what if your alarm was so sensitive it screamed at burned toast? Or humidity from your shower? Even when there's no actual danger, it blasts away, keeping you on edge. That's exactly what happens in many cases of chronic lower back pain. Your nervous system becomes hypersensitive. Even small signals, slight movements, minor postural shifts, or mild stress set off a huge protective response. It sends messages down your spinal cord to tighten your back muscles. Why? Because it thinks your spine might be at risk. It braces everything to protect you, even when there's no real structural threat. This is why your back stays tight, even when you're not doing anything. A lot of people assume, my back hurts because it's weak or out of alignment. But in reality, your back muscles are often overactive, not underactive. They're clamping down all day long, trying to guard your spine. That constant tension compresses your discs and joints, reduces blood flow, and keeps your lower back feeling stiff, sore, or even burning. Ever notice how your back sometimes aches worse after a stressful day at work, even though you didn't physically do much? Or how it tightens just thinking about lifting something heavy? That's your brain on protective overdrive, preparing your body for a threat that doesn't actually exist. Why typical solutions fail? They don't reset your nervous system. Most mainstream approaches completely overlook this. They treat your back like it's a mechanical part that simply needs to be stretched, strengthened, or numbed. Let's break this down. Painkillers. They block pain signals temporarily, but the problem is still there under the surface. The tension, the guarding, the hypersensitive alarm system, none of that changes. That's why the pain often returns as soon as the meds wear off. Repeated stretching, pulling on tight muscles, might feel relieving for a moment, but if your brain believes your back is unsafe, it'll just order those muscles to tighten again, sometimes even harder than before. That's why people often say, I stretch my back every day, but it always feels tight again within hours. Surgery. In some cases, surgery is necessary, like when there's severe nerve compression. But studies show that for the majority of chronic back pain, surgery often doesn't change long-term outcomes. Why? Because surgery only alters physical structures. It doesn't teach your brain to stop overprotecting. Generic core strengthening. How many times have you heard, your back hurts because your core is weak? So people do endless planks and crunches, often tensing their backs even more. Their nervous system is already stuck in a guarded pattern. Adding more brute force can reinforce the tightness, not resolve it. The overlooked factor, your brain's memory of past pain. Here's something few people realize. Your nervous system has a memory. If you once threw your back out lifting a box, your brain took notes. Now, every time you lean over, even slightly, it remembers that past threat. It preemptively braces your back, even if the tissues themselves are perfectly fine. It's why you might say, it's the weirdest thing. Sometimes my back locks up when I do almost nothing, like reaching for the shampoo. How does that even happen? It happens because your nervous system isn't reacting to how heavy the load is. It's reacting to the fear of danger. Stress makes it all worse and keeps you stuck. Now layer in everyday stress, bills, deadlines, arguments, doom-scrolling social media. When your brain is stressed, it shifts into protect mode overall. Your breath becomes shallow, your shoulders creep up, your core tightens, and your lower back becomes part of that defensive posture. Add this up day after day, month after month, and your body practically forgets how to relax. Your brain treats your back like a fragile zone that needs round-the-clock guarding. That's why you might wake up after a full night's sleep and still feel that dull ache in your lower back. Your muscles were never fully off duty. So what actually works? Here's the hopeful part. Because your brain plays such a huge role in your pain, you can also teach it to stop bracing. But that doesn't come from endless stretching or numbing the area. It comes from sending signals of safety to your nervous system, moving in ways that restore trust in your back, calming your stress response so your muscles stop guarding by default. When your nervous system realizes your spine is stable, supported, and not under threat, it gradually turns down that overprotective tension. This is why people who focus on breath work, mindful movement, and small daily resets often see pain melt away, sometimes after years of struggle. What's next? In the next part, we'll dive into exactly how to do this step by step. You'll learn the simplest way to use your breath to calm your nervous system, how to move without triggering old fear patterns, and tiny daily habits that send your brain the message. It's okay to let go of this tension. Because pills and surgeries target your body, but real healing often starts in your brain. All right, so by now, you understand something most people with chronic lower back pain never hear from their doctors. Your back isn't just hurting because it's weak or because something is permanently damaged. It's hurting because your nervous system is keeping it guarded, often long after any real injury is healed. And that means your brain is actually the key to unlocking long-term relief. But here's the problem. Most people try to force their back into feeling better. They go harder at stretches, push through intense core workouts, or use massage guns to pound their muscles into submission. It might feel good for a little while, but soon enough, their lower back tightens up again, because their brain is still running the same old protective program. The real change comes when you teach your nervous system that your back is safe. So let's break down 3 of the simplest, most effective ways to do exactly that. 1. Use your breath to flip the switch from threat to safety. When your body is stuck in fight or flight, your breath is one of the fastest ways to shift gears. Most people with chronic lower back tension breathe high and fast. Their shoulders lift, their chest puffs, but their belly stays frozen. This signals danger to your brain. Your core stays locked. Your back muscles stay on high alert. Deep diaphragmatic breathing does the opposite. It sends your nervous system a powerful message. We're okay. It's safe to let go. Try this. Sit or lie comfortably. Place one hand on your chest, the other on your belly. Inhale slowly through your nose for a count of 4, letting your belly rise into your hand while your chest stays mostly still. Exhale gently through your mouth for a count of 6, feeling your belly soften. Repeat this for 8 to 10 slow breaths. It may feel awkward at first. Many people discover they can't easily breathe into their belly. That's how locked up their diaphragm and deep core become. But with gentle repetition, your body relearns this calming, stabilizing pattern. 2. Rebuild trust in movement with slow, mindful practice. Another huge reason your back stays tense is that your nervous system doesn't trust certain movements anymore. Maybe years ago you bent forward and threw out your back. Now, every time you lean to pick something up, your brain tightens your lumbar muscles before you even finish the motion, just in case. It's like an overprotective bodyguard, so you have to slowly teach it. Look, we can bend. We can move. Nothing bad happens. You don't need to lock up. The best way is with slow, gentle movements that show your brain your spine is stable. Example, the hip hinge drill. Stand tall with your feet under your hips. Place your hands on your hips, keeping your spine neutral, no rounding or arching. Gently push your hips back as if trying to close a car door behind you. Move only a few inches, then return to standing. Repeat 8 to 10 times, breathing slowly. Done with calm breath and no rush. This repatterns your brain to see hip bending as safe, so your back muscles stop overcompensating. 3. Daily micro resets that tell your brain your back is stable. You don't have to spend an hour a day on complicated exercises. In fact, tiny moments sprinkled throughout your routine are often more powerful. They continually send your brain the message that your back is supported, so it doesn't need to guard. Try these simple daily resets. Chair decompression. Sit back in your chair, feet flat on the ground. Let your low ribs soften. Take 3 slow belly breaths. Legs on chair at night. Lay on your back on the floor, calves resting on a chair. This puts your lumbar spine in a neutral position and gives your muscles a chance to completely let go. Gentle rotations. Stand tall, hug yourself lightly, and slowly rotate left and right. Keep it small, slow, paired with calm exhalations. Each of these takes under a minute. Over days and weeks, they build a new normal, a back that doesn't feel it needs to be on constant high alert. Why this approach works when so many others don't. Most treatments, pills, braces, even a lot of back strengthening routines, completely ignore your brain. They treat your pain like a purely mechanical problem, but your body doesn't operate like a dumb machine. It's a brilliantly protective system. If your brain still feels your back is unsafe, it will keep telling your muscles to guard. No amount of stretching or medication can override that. When you instead send your nervous system repeated signals of safety, through breathing, slow movements, micro breaks, you change how your brain perceives your back. Over time, it stops issuing those protective commands. Your muscles stop clenching. Blood flow improves. Pain sensitivity dials down. This isn't instant, but it's how lasting change happens. A lot of people give up after a few days because they expect a miracle fix. But remember, your brain learned these protective patterns over years. It takes gentle, repeated practice to unlearn them. The amazing part? Most people start noticing small wins in the first couple weeks. Maybe you get out of bed without quite as much tightness. Maybe you stand at the sink without shifting side to side. Maybe you catch yourself taking a deep belly breath at work, and your back releases just a little. Wrapping up part 3, setting the stage for your new life. So think about this. What would your mornings feel like if your back wasn't already tight before you even brush your teeth? How would it change your day if you didn't have to plan your movements around flare-ups? How would your mood improve if your body didn't always feel one wrong move away from locking up? This is what happens when you stop forcing your back into submission and start teaching your brain that your spine is safe. All right, if you've stuck with us this far, it means you're ready for a real change. Not the kind of change that comes from a quick fix or new pill, but from finally addressing the real reason your back keeps hurting. In the last parts, we broke down exactly how your brain and nervous system are driving your lower back pain. You've learned that your back muscles tighten to protect you, even long after the original injury is healed. Stress and shallow breathing keep your system in guard mode, making your spine feel threatened. Old memories of pain cause your brain to brace before you even move. Now, we're going to put all that into action with a practical, doable daily plan. One that you can start today. No special equipment, no expensive appointments, no fear of flaring things up. Because here's the most important thing. Small, consistent signals of safety to your nervous system will do more to heal your back than any aggressive stretch, hardcore workout, or pile of painkillers ever could. Morning reset. Start your day with calm, stable support. Most people with back pain wake up already tense. They roll out of bed and immediately feel that tight band across their lower spine. That sets the tone for the rest of the day. So let's flip that script. How to do it. Sit at the edge of your bed with your feet flat on the floor. Place one hand on your belly and one on your chest. Inhale through your nose for a count of 4, feeling your belly rise more than your chest. Exhale through your mouth for a count of 6, letting your ribs soften down. Repeat for 8 slow breaths. This alone sends a powerful message to your brain. We're safe. There's no threat here. We don't need to brace. Bonus tip. As you stand up, gently brace your belly by imagining someone is about to poke your stomach. This gives your spine a light, natural support without tensing your lower back. Midday tune-up. Keep tension from creeping back in. Even if your morning starts well, life piles on. Emails, traffic, deadlines, family stress. Without realizing it, your breath becomes shallow, your shoulders creep up, and your back slips back into guarding mode. A midday reset takes just 2 to 3 minutes, but it can completely change your afternoon. Try this simple combo. Stand up from your desk or wherever you are. Place your hands on your hips. Slowly push your hips back a few inches, as if closing a car door with but keep your spine long. Don't round forward. Return to standing. Repeat this hip hinge 10 times. Move slowly. Pair each movement with a gentle exhale. Then place your hands on your lower ribs. Take 3 slow belly breaths and continue with your day. This tells your brain your hips, not your lower back, are handling movement, so your lumbar muscles can let go. Evening decompression. Teach your spine to trust again. Many people's backs hurt the most at night. After a full day of tension, your lower back feels like it's locked in a vise. This is where a gentle decompression can work wonders. It gives your spine a break from gravity and teaches your nervous system it's safe to relax. Try this before bed. Lay on the floor next to your couch or a chair. Place your calves on the seat so your knees are bent at 90 degrees. Let your arms rest at your sides. Close your eyes and take 5 to 10 slow belly breaths, feeling your lower back gently melt toward the floor. Stay here for 5 to 10 minutes. It's not a stretch. It's a position of safety. Your spine is fully supported, your hips are relaxed, and your muscles start to release a protective clench. The secret sauce: consistency over intensity. If you take one lesson from this whole series, let it be this: healing your back isn't about doing the hardest workout or the deepest stretch. It's about teaching your brain, over and over, that your spine is safe. When your nervous system finally believes that, your muscles will stop locking up, your discs and joints will get better blood flow. Your pain sensitivity dial will turn down. It's the difference between living in constant tension, afraid that one wrong move will wreck you, and moving through your day with calm confidence. Your new daily plan, simple but powerful. Morning, 1 to 2 minutes of belly breathing before you even stand up. Light belly brace as you rise from bed. Midday, 10 slow hip hinges plus 3 calm breaths. Evening, 5 to 10 minutes legs on chair decompression plus gentle breath. That's it. Not hours at the gym. Not forcing painful stretches. Not chasing quick fixes. Just steady, repeated signals that tell your brain, this back is strong. It's stable. It doesn't need to be locked up anymore. Imagine your life without that constant tightness. Think about how your days might change if you didn't always have to worry about your lower back. You bend to tie your shoe without bracing first. You stand at the sink and cook dinner without shifting side to side. You get up from your chair without that little wince. You actually forget about your back for hours at a time. This is exactly what happens when you address the root problem, your nervous system's protective grip, not just a surface pain. So now, I want to hear from you. Which part of this daily plan are you going to try first? Drop it in the comments below. Your story might be the exact encouragement someone else needs to finally start this journey. And if this opened your eyes, hit like, subscribe, and share this with someone whose back pain has controlled their life for too long. Because healing is possible, and it starts with teaching your brain that your back doesn't need to be afraid anymore.